bipolar disorder, update on management and role of pharmacogenomics. This mental health awareness week happened May 12 to 18, and this year the theme is communities. Community, it can provide a sense of belonging, safety, support in hard times, mainly deals with connections so that mental health is not affected in people. So bipolar disorder, it is characterized by episodes of depression, hypomania or mania, mixed episodes with inter-episodic recovery. So there are two types. One is bipolar disorder 1. It is diagnosed when individual has manic episodes, whereas bipolar disorder 2, it has hypomanic episodes without mania as well as depressive disorders. So it affects 1% of the global population and has a strong genetic basis like schizophrenia. So around 65% of the individuals have one psychiatric comorbid conditions. It can be anything like anxiety, OCD, substance abuse, mainly cocaine, or personality disorders. So this is about so mood state. It is characterized by elation or intense irritability with hyperactivity, over-involvement, and life activities. So it is mainly atypical manic episodes. They have delusions, hallucinations, and usually related to grandiose perception. So patients with 4 or more discrete episodes, they are termed as rapid cycling. So this is about mania. And what is hypomania? So hypomania is nothing but distinct period of abnormal elevated mood, but it lasts for only 4 consecutive days, whereas mania refers to 7 days, and this is the two criteria. So this is the modified DSM-5 criteria. Accordingly, they have classified, defined hypomania criteria. The difference between mania and hypomania is only duration. That is, hypomania is 4 days, whereas mania lasts for 7 days. So goals of treatment to enhance cognitive function, address circadian disturbance because there can be disturbance in sleep in bipolar disorder patients, manage psychiatric and medical comorbidities, improve functionality and quality of life, and reduce the risk of suicidality. So these are the goals of treatment. So the main drug is mood stabilizer is lithium. So it decreases the frequency and severity of both mania and depressive attacks. So it is started at a dose of 300 to 900 milligram daily, and usually therapeutic drug monitoring is done when lithium is given. So that is because it falls in the narrow therapeutic range. The range is nothing but 0.8 to 1.2 milliequivalents per liter. That is trough levels. So it is measured before the next dose. That is the trough level. And because the therapeutic effect doesn't appear within 7 to 10 days, it is better to use lorazepam, clonazepam, and other benzodiazepines to control the agitation. So level should be monitored because to avoid any risk of volume depletion. Okay. So once a day dosage is acceptable for maintenance therapy. The side effects include, since it is taken through oral route, so few GI symptoms are expected. So you have to take with food and in divided doses. So fine tremors, it can be treated with propranolol. So that is a beta blocker which controls tremors and used for panic conditions. So the other side effects include weakness and somnolence, polyuria, and weight gain and leukocytosis. Well, leukocytosis is nothing but it is actually a therapeutic side effect. It can be used for leukopenia patients. So it also affects thyroid functions, and hence thyroid and kidney function should be checked 4 to 6 months intervals. Long-term side effects include it affects the kidney, that is manifested by a rise in creatinine levels, and it also has consciously mothers who take lithium because it is excreted through breast milk. So that is the points you have to note down regarding lithium and significant overdose, that is toxicity occurs about 2 milliequivalents per liters. So in that condition, hemodialysis should be done. So this is other drugs like carbamazepine, lamotrigine. They are also used for anti-seizure drugs, and they are used as second line agents for to control the patients in bipolar disorder patients. So carbamazepine, it's 200 milligram twice daily, and it is given according to the therapeutic range. So therapeutic range is 4 to 12 microgram per ml, whereas lamotrigine it's FDA approved for bipolar disorder also. So it is given with lithium to control the episodes. So to control the manic episodes. So rare side effect is T1 syndrome. So this I will highlight while coming with pharmacogenomics part. And valproic acid, it is first line treatment for mania. The GI symptoms and weight gain are the main side effects. So since the GI side effects and weight gain are present, so they have to be monitored at 2 weeks, 4 weeks, and 3 months initially and annually. So only thing it has to be given, it should be avoided in patients who are having excessive weight gain, and also it is found to be teratogenic. So that caution must be given to the patients. So that is about valproic acid. So this is cariprazine. Cariprazine is partial agonist at D2 and D3 receptors with the selectivity of D3 receptors. So this makes it unique among other atypical antipsychotics, and the risk of getting extrapyramidal symptoms is very minimal comparison to the other antipsychotics. Akathisia is most common side effect. Other drugs, olanzapine, risperidone, aripiprazole are also given, and as maintenance therapy. The antidepressant medications should be given cautiously, or better can be avoided during maintenance treatment, because the risk of precipitating mania and accelerating the cycle frequency is present. So it has to be given cautiously. The antidepressant medication should be given carefully. So combinations treatment also is available with mood stabilizers. Atypical antipsychotic drugs are also given. Extended release means the duration of action is enhanced. So quetiapine, olanzapine, lamotrigine have been approved for maintenance treatment as sole agents or in combination with lithium. So these are also adjunctive drugs used for bipolar disorder. So this is in short about how patients can be managed pharmacologically for bipolar disorder patients, mania, depression, and maintenance therapy, which drugs to be given. So treatment refractory conditions. So how could we, what is the reason? So one can be non-adherence. Next will be failure to optimize the dose and therapies. Comorbid conditions should be treated, and adequate dose must be given for an adequate duration of time. So it will take some time to act. So that duration of time should be given to assess the response in patients and exclude the possibility of genomic related poor response. So that I will highlight in pharmacogenomics part. So ultra rapid metabolic status means once you give the drug will be metabolized very fast, so that the action is will not be present. So that possibility should be excluded. So these are the management, how bipolar disorder is treated. History taking is very important to find out any other conditions, comorbid condition, and pharmacological. ECT is usually given for uh, to attain rapid control of the symptoms. ECT is given. Other non-pharmacological management include psychoeducation and psychosocial intervention. So this is various you have to note down. These are sometimes because there can be clinical heterogeneity and difficult to diagnose. So the patients can be in any phase, like they can be in hypomania, mania, depression. So difficult to diagnose, and comorbid conditions are also one barrier to treat the patients. And adherence and stigma. Stigma usually it's present in cases affecting the mental health, and patient and caregiver education is very, very important, because they will take care of the patients and they should know about the disease. They should be aware of the disease and the symptoms of bipolar disorder. So these are the some various barriers to which can hinder the treatment in bipolar disorder patients. So this is so actually a flow chart, like chart regarding the treatment of bipolar disorder. Euthymia means normal mood, mania means increase, and depression means uh, depressed mood. So this is hypomania. It's mania differentiated only by the time. So how much time the symptoms are present based on the treatment is given. So future aspects, there involves inflammation and generation of free radicals. So agents with anti-inflammatory antioxidant properties are tested in trials. Verapamil means calcium channels have a role in uh, prolongation of the disease or progression of the disease. So calcium channel blocker is also tested as a recent advance, and NSAIDs mainly to used as a reduce the inflammation, and deep brain stimulation devices are also used as a part of treatment for bipolar disorder. So genomics, because if you give the drug, so some patients will respond to the drug, some will be not responding. So the gene status should be known to the clinician to give which group of drugs to which patients. So that is the role of pharmacogenomics. Genetic polymorphisms. So you have to identify the genes. So drugs gets metabolized by enzymes. So those enzymes are coded by the genes. So if there is any gene polymorphism, so that will affect the function of the action of the drug and thereby the response given by the drug. So role of genetic polymorphism is also very important because it can identify either risk factor or protective factor to affect the development of bipolar disorder. So these are the common genes. DISC1 that is disrupted in schizophrenia 1, anchorin. So CACNA1C means related to calcium channels gene. TPS2 means tryptophan hydroxylase 2, and DAOA means it is actually a amino oxide activator. So this is common genes present in chromosome 1, 10, 12, and 13. So Q is nothing but a long arm, whereas P is short arm in the chromosome. So this is the common genes affected, and so it's related to calcium channel genes. So this polymorphism was correlated with reduced severity of depression and insomnia. The alleles RSID means reference SNP. So they were found to have a protective episode effect on episodes of bipolar disorders. So related to disc one, so involvement was found suggested by Palo et al. In the study, and hence it is associated with lowered activity of ERK, reduced gray matter, and increased risk of depressive disorder. Mainly, this gene is related with increased risk of getting depression. So anchoring 3, it is also found to have a role in bipolar disorder, and in mouse in brain. So it is found to be responding to lithium. So this can be suggested as one target where the genes can be explored to test for bipolar disorder. TPH2. So this gene is also it lies in the TPH2 protein coding region, and bipolar disorder locus was found to be associated with bipolar disorder. So this also holds that the TPH2 can be acted as a target for bipolar disorder. So DAOA means so it's actually a role in predisposition of the individuals with both psychosis and mania. So depression is associated with greater glutamine function, and patients with mutations in this gene was associated with affective disorders. So this gene is also can be explored. And genes in other neuropsychiatric drugs. So related to COMT, dopamine receptor, serotonin, these genes can also be explored related to effect of bipolar disorders. So genes associated with lithium response. So these are the genes which, so why lithium means it's commonly given as a mood stabilizer in all patients. So it has the based on the mechanism of action, the involved genes are studied in various in literature, and this is about how the genes perform. For example, COMT, there is association between this RSID and poor response. So in this case, presence of mutant type will affect the response. That is, even if you give the lithium, if the patient is having this genotype, he will not respond properly. So that is the meaning of the COMT. Similarly, all genes have been explored in literature. So this is about pharmacodynamics. SNP is related to pharmacodynamics of drugs used in bipolar spectrum disorders. So HTR1A, so 5-hydroxytryptamine receptor 1A, mainly it's a serotonin. And for example, patients with CC genotype decrease response to antidepressants as compared with GG or CG genotype. So usually GG means it is wild type, that is normal. CG means heterozygous. CC means mutant. So this mutant type have decreased response to antidepressants. So similarly, all genes have been uh, found in 14 et al. Study published in 2019. So SNP related to pharmacokinetics. ABCB1 means ATP binding cassette protein. So these drugs, so mainly it is involved in transport. So it's a membrane transport gene which affects the response. So if it is present more, the uh, drug will not reach the site of action. Hence, there will be poor response. So these are the drugs related where the transport is related with these drugs: carbamazepine, phenytoin, aripiprazole, olanzapine. So these drugs they get transported through ABCB1 transport coded by ABCB1 gene. So focus on side effects. So important thing to note down is genetic risk variants. They also associated reduction of EGFR because renal dysfunction. So risk of getting kidney dysfunction is high in case of uh, bipolar disorder patients. And hence, carbamazepine causes life-threatening areas like Stevenson's syndrome and TEN. So how to differentiate is toxic epidermal necrolysis. It affects more than 30% of the body surface area, whereas Stevenson's syndrome less than 30%. So this is actually FDA. So in the drug label itself, it has been mentioned that HLA B star 1502. If this is present, the patient should be given cautiously, or they should not be given if they belong to Southeast Asian origin. So this is about, so this is one implication where pharmacogenomics definitely play a role in patients who are getting treatment for either epilepsy or bipolar disorder or other conditions, health related conditions. So this is in summary about bipolar disorder. We saw mainly the depressive or manic symptomatology. You have to identify which symptom the patient is having, and accordingly, we have to treat with either lithium, that is mood stabilizer, with related. So any psychosis means you have to treat with antipsychotic drugs or antidepressant drugs to control the agitation. So with the implementation of pharmacogenomics part, so the patient will be treated better, and in the personalized approach, it will be beneficial for both the patients as well as the clinicians. Thank you.